on this topic, balancing people management and productivity metrics in healthcare using emotional intelligence. Balancing people management and productivity metrics in healthcare using emotional intelligence. We realize that we have three key words or three key phrases in this particular topic. Next slide. We have three key parameters in this topic. The first one is what? People management. The second one is healthcare productivity metrics. And the third is emotional intelligence. Those are the three important parameters that we really need to clarify as we continue. The next slide. Now, I'm defining emotional intelligence first. We realize that emotional intelligence is an individual's ability to recognize their own emotion, manage their own emotion, recognize emotion of others, interpret emotion of others, manage people using social skills in a way that they are able to get the best out of every situation. Next slide. Emotional intelligence, we have three important things that we must always bear in mind. The first thing is recognition. A lot of time why we struggle to manage people is because we do not understand what we are dealing with. We do not recognize the emotion that we are dealing with. Are they angry? Are they happy? Are they grieving? Are they just not interested? Are they distracted? We need to recognize this emotion, because that is going to determine what will be our approach of intervention. So the first component of emotional intelligence is our ability to recognize the emotion we are dealing with. And the second component is we should be able to define appropriately that emotion. When we recognize the emotion we are dealing with, we should also be able to define or discern the appropriate emotion and translate the emotion appropriately. Like, for example, I have been in situation where a mother bringing a child that is convulsing, and because the child is convulsing, the mother is agitated and she's shouting at everybody. Now, she's shouting, and the agitation, the shouting and the agitation, they are due to panic. She's afraid. The woman does not understand what is going on. So because of that, she's shouting. Now, typically, we will see healthcare professional that will be trying to ask the woman to calm down. They will just be saying, "Madam, calm down. Can you please calm down?" But the woman will not be calm. Instead, the woman will continue to shout. In fact, if the situation is not well managed, the woman will not only shout, the woman will start insulting people that are working in that particular healthcare facility. Now, what is the problem here? It means that the healthcare professional has been able to recognize abnormal emotion, or more or less has been able to recognize negative emotion. Emotion can be positive or negative. Example of positive emotion is excitement. Let's say I heard about something and I was excited about it. Another example of positive emotion is joy. Another example of positive emotion is happiness. And one example of negative emotion is anger. Another example of negative emotion is panic, like the example that I gave. When an individual is in panic mode, or an individual is afraid of what is going on, because the individual cannot interpret what is going on, or the individual believe what is going on can be dangerous or can have a bad end, like in case of the woman that I talked about that was carrying a child that was convulsing. Now, discerning what the situation is will mean that you will know that there is no way this woman can be calm just because you are asking the woman to calm down. Because I don't know how a woman in that kind of circumstance will be calm. The woman's child is convulsing, and I am saying, Madam, woman, can you please calm down? The woman cannot be calm. What I can do is to carry out appropriate action based on knowledge. You now see, translation and action from knowledge. With good emotional intelligence, I will know that once I am able, or the healthcare professional that is there is able to intervene by collecting the child, giving appropriate anticonvulsants, ensuring the convulsion is being aborted, and the child is returned to normalcy, you will not need to tell the woman to calm down. So what will be appropriate action for me will be that I am intervening. In fact, the moment we are taking action, the woman will gradually return to a state of calmness. But it will be lack of emotional intelligence for me to be asking people to calm down when they are in danger. The first thing I will need to do is to intervene. After I have done my intervention, I can now, either myself or another person, can now start asking them to calm down. So it becomes very important for us to note that with good knowledge of emotional intelligence, we'll be able to recognize people's emotion, because it is the emotion that will determine. You recognize the emotion, you define appropriately what the emotion is. What do I mean by defining appropriately? Just like I said, you label it. This woman is shouting. That's a shouting. You have identified that. You are able to recognize that. What's the definition? Because she's afraid. Like the example that I gave, she was shouting because she was afraid. Then what I should do is to intervene, try and rescue the situation. Once I have done that, I will realize that the woman will return into calmness. 3 wrong steps that I can do is to say, woman, just start shouting like I'm shouting back. Don't come and shout at us here. That will be a wrong action. Another wrong action will be that I'm asking the woman to just calm down without any form of intervention. Another form of wrong action will be that I am trying to blame the woman for what has happened. Those will be wrong action. It will mean that I do not discern what the situation is, and I am not taking appropriate step to mitigate what is going on. Next slide. Now, there are components of emotional intelligence. If you will not remember anything about emotional intelligence, you must remember the fact that 1, you must be able to recognize your own emotion. Your own ability to recognize your own emotion. Once you are able to recognize your own emotion, you should also be able to manage your own emotion. So 2 in 1. You are able to recognize your emotion. You are also able to manage your own emotion. Another part is you should be able to recognize the emotion that you are dealing with. Somebody who is anxious is different from somebody that is rude. Somebody who is angry is different from somebody that is irresponsible. Although there are links between all these parameters, but it is important that you label and define appropriately the emotion of others. Then another part is the social skill, which is what we call people management skill, which is the core of what we are discussing this morning. Then we also have empathy. What is empathy? Empathy is my own ability, my own capacity to put myself in other people's shoes. If I am unable to do that, there is no way I will be able to manage them with social skills. Individuals with very good social skills, part of what they have learned how to do is how to be empathic. Empathy is different from sympathy. In empathy, what you are trying to do is to understand things from their perspective. And the last part of emotional intelligence, a highly emotional intelligent person is a highly motivated person. They are motivated to get results. Next slide. Now, the next parameter is, what are healthcare productivity metrics? Another name for productivity metrics is key performance indicators or key performance index. Now, just like we can see on the screen, key performance indicators, they are quantifiable or measurable factors that can reflect the goal of an organization. Now, if you do not have parameters that you are measuring, it means that you are not clearly defining your goals. You are not clearly measuring your improvement. You are not documenting your progress. Key performance indicators or productivity metrics will help us to measure progress. It will help us to measure improvement. But one thing that we need to take note is that we need to be intentional in order for us to be able to measure performance. And to measure performance, it will depend on the organization that we are talking about. For this morning session, the organization that we're talking about is healthcare. What are important productivity metrics in healthcare? We are going to look at that because it is comparing productivity metrics that will allow us to know if we are making progress or we are actually deteriorating. There are metrics that we expect to increase, and there are metrics that we expect to decrease to measure growth and improvement. Now, let's go to next slide. I am going to show us some of the productivity metrics. Now, productivity metrics in healthcare, we can grossly divide them into three. Either productivity metrics that has to do with operational efficiency, meaning how efficient the healthcare facility or the healthcare system we are talking about are. Are they very efficient? Are they very effective? Operational efficiency is one metrics that we can measure. Another metrics will be things that has to do with finance. Another metrics we can measure are things that has to do with internal process. And I'm going to show us some examples of these metrics and why it is important for us to measure some of these parameters, and what is the effect of measuring some of these parameters on the emotion of healthcare workers. You now see? Now, because measuring these metrics will affect the emotion of healthcare worker is the reason we should understand how to now manage people. The fact that measuring these parameters will affect how people feel, will affect people's emotion, is a reason we now need to understand how to manage them so that we can balance improving our metrics. At the same time, we are ensuring that our staff are loyal to us because they are still happy about the organization. Because there's no way we can guarantee productivity when professionals that are expected to drive the productivity are not happy about the organization, and they are just there for the main time. They are already looking for how to leave the system. All right, so let's look at example of operation efficiency. I will run through this, and one example of operation efficiency is admission rate. How frequent do we admit people in that facility? Now, we know that if there's a high admission rate, what does that mean? It will mean that individuals or patients or people in that community, they have belief in that particular health facility. Because I've seen health facilities that people will leave, people that are living around that particular health facility will not use the facility, and they will travel miles, they will travel kilometers to another facility. So admission rate is a key performance indicator that shows how a particular health care is being utilized. Next slide, sir. Next slide. So just like you have said, admission rate is very important. It indicates, can you see? Admission rate is very important because it indicates efficiency. It shows if people are really enjoying the service provided. Now, how do we measure admission rate? So we can choose to say we want to increase admission rate. You know, I said part of what we learn is how do we create measuring tools. So that means in your facility you can say, okay, in the month of January, how many patients did we admit? In the month of February, how many patients do we admit? Then the next thing we want to do is we want to improve our admission rate by 10%. You can say that is very specific. Then you can check, okay, in the month of January, we admitted 100 patients. In the month of February, we admitted 120 patients. So the difference will be 100 minus 120 minus 100, that gives us 20. So 20 over 100 times 100 will give us 20%. So it means there is what? Progress. Now, it is important for us to track this kind of parameter so that we will know if the hospital is improving or the health facility is improving or the health facility is deteriorating. You will see more people utilizing this particular facility, or the number of people using this facility is reducing. Why is this important? This is important because if you do not measure increase or decrease, you will not know if you will need more staff or you are underutilizing your staff. Like for example, if you have healthcare professionals that can serve up to 100 patients and the number of patients that are coming to that facility is just 30, it means that you are wasting human resources. So there are two options: either you increase the admission rate or you ask that they redeploy some staff. If you do not do that, the implication is that you are wasting human and material resources. Another thing that could have been done will be that we say, okay, since we can serve up to 100, we need to develop structure that will ensure that we fully utilize the resources that are available by causing a 10% increase in admission rate every month. Now, the 10% increase in admission rate can now be, okay, maybe we create advocacy, or maybe we create awareness. We let people know. We don't advertise health center, but you can make people aware of the existence of that particular healthcare facility so that they can be used. Like I remember there was a time the wife of a governor or a commissioner in some countries, equivalent of a commissioner like in Tanzania, decided to screen all women free for human papilloma virus. But people are not aware. So the kit was there, personnel was there, so the service was not being utilized. So if they are measuring, that project was meant to last 2 years. If they are measuring, then they will know what to do. If they are not measuring, they will not know. They will just stay there and be wasting resources. That is why it is important that we have parameter like admission rate being measured. Next slide. Another parameter that we should always measure is patient satisfaction score. This is very important. When patients are satisfied, they will come back for follow-up and they will tell other people about the healthcare facility. I observed that most of healthcare facilities in Africa, they don't actually measure patient satisfaction. And this is very simple. How to do it is that you can create a very small paper box that we have. You can either, if you want the patient to say or do their reporting anonymously, they just use patient number 10, and you just have another part where they will say satisfaction score. You tell them if you are so satisfied, you give 10. You are fairly satisfied, you can give 7. You are not really satisfied, 4. You are very angry about the service, 1. Why is this important? You can have a box where they can record this so that you can check, are patient really satisfied? Now you can combine this particular tool with another tool. You can have a combined tool that will have patient satisfaction and patient complaint. So on the first page on the first page, they can have satisfaction score. Now, this satisfaction score, you can eventually take average. That, okay, this month, the average patient satisfaction score is 70%, is 50%. Now, how do we improve the patient satisfaction score? Now, on the other side, you can have patient complaint. For patient complaint, you can ask them, do you have any complaint? You ask them, they write the complaint. Then you ask them for yourself that what do they suggest the healthcare facility should do better, so that will help you to understand their expectation. Because over time, I have seen that people, irrespective of how good you are doing for people, if you are not matching their expectation, they will still not be satisfied. Sometimes ago, I was explaining about gifts in a particular forum where I was teaching about how to give gifts. And I was explaining that it is important that you give gifts that people love, not what you love. A lot of times, sometimes when people want to give things to people, they give what they like. Like, for example, let's say my best color is blue. So when I'm now buying a gift for another person, I can choose to go and buy blue. That's not the way it works. It is important that we understand people's expectation so that we'll be able to match their expectation and they can get satisfaction. That can be done by asking them, what are the complaints that you have? Then what are your suggestions for taking care of this particular complaint? That way you will know exactly what to do. Next slide. Yes, I've explained this. So we can always say, after we have seen that, okay, patients are not satisfied, we have some patients that are not satisfied. You remember I said it's always better you merge patient satisfaction score with patient complaint form, so that those that are not satisfied, they will tell you why they are not satisfied, and they will tell you their expectation. Very, very important. Next slide. And you'll be able to measure the percentage. Next slide. I've just talked about patients' complaint. It's very, very important, because once patients always have complaint, in a matter of time, they will stop coming to your facility. Not only that, they will also not believe whatever you are telling people. Next slide. Now, another key performance index is patient wait time. How long do patients need to wait in your facility before they are able to see a healthcare professional? It is recommended that it should not be more than 10 to 15 minutes, at least before the first person is talking to them. Either the person that is helping them to check for their file, or the person that is helping them to file their complaint so that they can be seen by a healthcare professional. It's recommended that it should not be more than 10 minutes. That's why I put this in at 10 minutes. Next slide. We have said patient wait time. A lot of time, the major complaint in a lot of healthcare facilities that people wait for so long before they are being seen by a healthcare professional. Next slide. I will try to move fast so that we can now see. So we can now say, like, for example, now it is important, like those of us that are working in district hospital, you can just start on getting back to your hospital. Just create. Let, as patients are coming in, check the time. As patients are being seen, you can document that. Keep that record first to say, okay, average of how many minutes does it take for patient to be seen, so that you can now see, is that fair enough? Do they need to wait for 1 hour? Do they need to wait for 2 hours? Do they need to wait for 10 minutes? Then once you have said that, once you have observed there's a delay, the next thing you now do is to find out what's the cause of the delay. Once you identify the cause or the causes of the delay, then you can now set a goal. Let's say initially it's in your facility is 1 hour, then your goal can now be, okay, in the next 2-3 months, or by May or by April, I want to reduce wait time from 1 hour to 30 minutes and continue to make that kind of progress. That's how to improve productivity metrics. Next slide. Another is bed occupancy rate. What percentage of the bed in your facility is being utilized? Because it's very important. That is your measure of how utilized your healthcare facility is. It's very important that you know. Are they well utilized? Is your hospital bed always full? Now, it is important for you to understand this. If your hospital bed is always full, it will mean that you are actually overworking your staff. A lot of time, when hospital beds are always full, your staff, they are almost at the point of burning out. So it might be important for you to ask, if the hospital beds are always empty, the implication is people are not really using that facility. And you may also need to find out why. So very, very important that we measure bed occupancy rate. Very, very important. Next slide. Next slide. I've talked about bed occupancy. So, and we can now say, okay, I want to decrease bed occupancy rate. Let's say a situation whereby your bed is always full. You can now say, okay, does that mean we retain some patients that are meant to have been discharged on admission? Does that mean we are admitting patients that we are not meant to admit? What are the reasons why we always have full bed? Because the implication of full bed will also mean that you will not have opportunity to admit some patients that decide that require admission because your bed is always full. So if your bed is always full, the target will be, we want to reduce or decrease the admission or bed occupancy rate. If it is always empty, if beds are always empty, then the target will be, we want to increase bed occupancy rate. Usually you can use percentage. I want to decrease by 10%, 20. I want to increase by 10, 20. These parameters are things we should always measure because they have a way of affecting the people working within the healthcare sector, healthcare system. Next slide. Another example is average hospital stay. How long do people stay in the hospital? Note that creating a tool for average hospital stay will require you to do it section by section. Like for example, you cannot just do average hospital stay. An individual that you admitted for malaria will definitely stay shorter in the hospital compared to an individual that had fracture of the let's say the fracture of the lower limbs, that an open reduction and internal fixation has been done and you want the patient to stay a little, or an individual that has undergone open heart surgery. So that means region by region you might need to check, okay, after delivery, what is the average hospital stay? Okay, after cesarean section, what is the average hospital stay? After admission as a result of severe malaria, what is the average hospital stay? It's better you sectionalize it because these parameters, you can use them to track your improvement. You can also use them to track the pressure on your staff. Like a unit with just 2 doctors, that you realize that their bed is always full, patient always stay long on admission. You don't need anyone to tell you before you yourself will know that the people, the doctors, the 2 doctors, or maybe another 3-4 nurses that are working in that part of the hospital or in that particular facility are actually being overworked. You don't need anyone to tell you before you know that they are under very serious pressure, which will in turn affect their productivity. Next slide. Next slide. We have talked about average hospital stay, so we can now decide. Then another one that should be very important to us is the staff-patient ratio, which can be doctors-patient ratio, nurses-patient ratio, physiotherapist-patient, staff-patient ratio. Now, why is this important? If staff-patient ratio is small, it will mean that we are overworking the healthcare professional. And once we are overworking the healthcare professional, we should know that we are actually not getting the best from them. And they will soon burn out. In fact, they may actually leave. I have a colleague that the only reason he left his country to another country was because of burnout. By the time he was collapsing on the theater table the second time, he told himself that if I should continue to work in this kind of facility, I will soon die. So in order to preserve his life, he needed to resign and look for a greener pasture. Now, to prevent occurrence of such scenario, to prevent the occurrence of such situation, if you are always monitoring your staff-patient ratio, you yourself, you will know by the time you are overworking people. Next slide. And I will show us some. Next slide. Now, in Malaysia, staff doctor-patient ratio is 1 to 600. And their own target, WHO targets, is 1 to 400. However, currently, because of shortage of doctors globally, World Health Organization has even increased doctor-patient ratio to 1,000. But a lot of countries in Africa, they are having very low doctor-patient ratio. Once you are having very low doctor-patient ratio, the implication will be that it's important for you to understand that you are overworking the healthcare professionals. If they are being overworked, then part of the intervention will be that how do we remove things that somebody else can do from their work so that the pressure of what they need to do will not get them burn out. Remember, we are looking at how to balance metrics, healthcare metrics, and their own job satisfaction so that we can keep the system going. Now, next slide. Now we can see this is a data for Nigeria. The healthcare professional generally, there is shortage in Nigeria. Look at the target for doctors, the target for nurses, but look at the deficit that we need in order to achieve that. We need about 300,000 extra doctors in Nigeria. I checked the parameter for Ghana as well. It's also as large as this. I'm sure if we check for Cameroon and Tanzania, I will even give you that tax. You will tell us by next session. Check online, what is the current doctor-patient ratio in Cameroon? What is the doctor-patient ratio in Tanzania? I will ask you in the next session. Now, why do you need to understand this? So that you will know if people are working under pressure or not. If the recommended ratio is 1 to 1,000 and you did the calculation for your country, you are getting 1 to 20,000. You don't need any soothsayer before you will know that your professionals, they are under severe pressure. And World Health Organization already have recommendation for different health professionals, the doctors, the nurses, the pharmacists, what should be the professional to patient ratio. That parameter is something we should continue to track. Like for example, if last year the professional patient ratio in my country is 1 to 30,000, and this year it has worsened to 1 to 40,000, I don't need to wait for patient to die before I will know that my health sector is deteriorating. Do we now know why we need to track parameters? If initially the number of nurses to patients initially was, let's say, 1 to 10,000, and the next time we're checking is already 1 to 15,000, I don't need patient to come and complain before I will know that there's deterioration in patient care, because there's limit. But any time you are making a professional to carry out a task, one person to carry out a task that 3, 4, or 5 people should be doing, you don't need to deceive yourself. You are actually not getting the best from such individual. So it becomes important that we track all these parameters, because they themselves will not be happy, and the patient that they are serving will also not be happy. All right, next slide. Now, another important thing is level of utilization of medical equipment. Now, there's something I observed in Nigeria, that there are health centers that, and this equivalent of district hospital is comprehensive health center, that we have phototherapy machine that should be used as intervention equipment for neonates with jaundice, neonatal jaundice. However, that comprehensive health center will sometimes not have pediatrician that will be able to use the equipment appropriately, and sometimes they don't even have the number of delivery that will necessitate the use of phototherapy machine. So that means the equipment will just be there without being utilized. So that means part of the parameters you need to keep in your facility, in your district, to check, okay, our ultrasound machine, how many patients do we use it for every day? Our X-ray machine, how many patients do we use it for? Our laboratory. It's very important that we take note of all these parameters. Why? So that we will know if the machine are being optimally used, or they are being underutilized, or they are being overutilized. If they are overutilized, it means that you are overworking your staff and you are also about to damage the machine. Very, very important. If they are not utilized at all, then what will make sense is that it should be recommended that you should move to where it will be used. Because a lot of time we always feel, this thing is for me, let me keep it here. But there is always the law of use and disuse. Whatever you are using well, optimally, will continue to produce results for you. Whatever you are not using at all, is a matter of time, will soon lose its function. So it becomes important that we utilize hospital equipment properly. Next slide. So another example is our theater. A lot of time we might have hospitals with theater and there are no patients using the theater, and sometimes we have hospitals without theater and there are patients that need the theater. So there should be a match between the demand and the supply of both hospital equipment and service. Next slide. Another is the patient room turnover rate. After we have discharged patient from the room, how long does it take us to get the room ready? I've been in a situation where patient relative were beating up the healthcare professional. Why? Because they brought an individual that require emergency intervention, and it was taking them too long before they get the room ready for patient to be properly admitted and taken care of. So you might need to check. These are parameters that usually we don't track. Okay, when we discharge people from the rooms, how long does it usually take before the room gets ready for another? Because a lot of time, the reason we don't check is because sometimes we are not using all our rooms. But if we improve our efficiency and there's need for us to admit more, that is when those efficiency will now become very obvious. But when we are tracking the parameter, okay, when we discharge patient, usually it takes 1 hour before the room is ready again. When we discharge patient, usually it takes 2 hours. That will help us to know if we need to improve on the turnover or we are doing well. Next slide. Next slide. Then finance. Finance is another key parameter that we need to track within the health sector. Next slide. Now, part of what we might need to track is what is the cost of drugs per stay. A lot of time, part of why, especially in countries, in regions where we still do out-of-pocket payment, usually a lot of time, the reason why there is high mortality in Africa is because we still make people pay out of pocket, because usually it is only government staff that are covered by health insurance. So people that are not government staff, because they are not covered, they usually look at the amount of money they need to pay in order for them to access health. But World Health Organization standard is that health should be accessible to all, and the way to do that is to improve on the coverage of health insurance, to improve the number of people that are covered by health insurance, so that people will not need to be paying out of pocket. Then we have said that drug cost per stay. Once the drug cost per stay is high, the patient definitely will not be happy, and it will affect utilization of the healthcare facility. Usually, a lot of patients always complain that they spend money too much. They spend too much money rather on any time they are in healthcare facility in Africa because of payment out of pocket. Next slide. Also, another parameter that is being tracked is cash flow. How much money is coming into the health facility? Usually, a lot of time, we don't track that when we are working in government hospital, but it's important. In fact, some of what some government agencies have done is to be able to generate a revolving fund where government is just augmenting. But private hospitals, private facility usually measure this cash flow very well, because they are the one that will, because it's measurement of cash flow that will determine sustainability of any system. If cash flow is reducing and you are not monitoring, you will not know, but the truth is that the organization is dying gradually. Whenever we see an organization that is there, we always assume it's one thing that happened, but the truth is the death is actually gradual. In fact, some organizations, they're already dead several days, several months, several years before the time we are seeing the manifestation. Next slide. Then profit margin. Cash flow will determine the profit margin. Profit margin is, especially in healthcare, in private healthcare facility, is very, very important that we manage the profit margin very well, so that you know if the organization, even though hospitals and healthcare service providers are not really profit-oriented organization, but it's very important that we check this margin so that they will have enough resources for improvement, for growth of the organization. Next slide. Another is average treatment charge. When an individual, like for example, let's say an individual is attending Dr. Deogratia's district hospital, how much will the patient need to treat malaria? How much will the patient need to treat hypertension? Average treatment is very important. A lot of hospitals, they don't have this parameter, so they don't know if patients are overpaying or underpaying. In fact, we have seen scenarios where they do not even have specific charge, definite charge for different procedures. It is important that these are clearly documented, so that if they ask that, okay, if an individual is being treated for malaria, what is the average charge? That is very, very important, so that, let's say, a government or an NGO, let me give an example. Let's, like in Tanzania, we have said that one of the commonest problems is malaria. Let's say an NGO decided that, okay, we want to pay for treatment of malaria of Tanzanians. The first question they want to know is that, what is the average cost? Let's say there's a foundation that says, okay, henceforth, we want to take care of people with hypertension, be paying for their, like in my country, in Nigeria, there are organizations that are paying for the treatment of people living with sickle cell disease. Now, part of what they will need to know is that, what is the treatment per child? It's a parameter that we should know. In your district, you can say, okay, for people paying out of pocket, what is the average charge? This may increase when there's increase in cost of drugs and other things, but it is important that we have these parameters, so that if we need to improve something, we have a way of measurement. Next slide. Now, just like we have said, more than 80% of people, when a survey that was done showed that more than 80% of people always want their caregiver to switch them to drugs that are cheaper. So it means even though your patients are still coming, you must always have it at the back of your mind that they prefer cheaper drugs and they prefer cheaper services. They want something cheap and yet quality. So it becomes important that you take note of the average treatment per child. Next slide. Next slide. Then, what is the wages that we are paying permanent staff? It is very, very important that we look at the wages we are paying permanent staff, and we continue to compare that to what is obtainable in other countries. If we are not doing that, we are at risk of losing our professionals to countries that are paying better. That is very, very important. That's why we see a lot of African healthcare professionals leaving Africa to the West. A lot of time is because of wages and the standard of living in those other countries. So this is a parameter that we need to track. Another thing we can track about this parameter, how frequent do we increase the wages of the permanent staff that are working with the healthcare facility? Because welfare of people is part of what will determine if they be loyal to the organization or not. Every worker will always try to be loyal to the organization they are sure is interested in their welfare. At the same time, a lot of organizations that are not taking care of the welfare of their staff will soon lose them to to other organizations with better welfare package. Next slide. Next slide. Next slide. We have talked about, so we can now say we want to increase the wages. Then revenue leakages. Are there ways by which people steal from the organization? Because it's very important. If you are not tracking that, okay, we bought 10 cartons of drugs. At the end of the month, we are able to only account for 9.5. So it means we lost 0.5. The next month, we'll check again. We need to track those leakages so that we know how to improve on sealing the leakages and improving productivity. Next slide. Then, apart from that, the admission rate. Patients who have discharged, how often, what is the rate of their readmission? Next slide. So, then we can as well generate other key performance indicators as related to our own healthcare facility. Next slide. I will leave the rest so that I just decided to pick some of these metrics. Maybe during our virtual session, I will talk about all the important metrics that should be present. But I just give internal process, like we have talked about metrics for the nationwide operation efficiency, internal process. Let's look at some examples of metrics under internal process. One example of metrics under internal process is the training per department. How often do we train our staff? Do we just complain about what they are not doing well? Or do we train them so that they can be doing what we want them to do the way we want them to do them? It's very important that we train. So we count how frequent. Then if we realize that, like for example, let's say you just do training 1 per year, you can start by saying henceforth we want to be doing training every 3 months. Then part of what you train people on is that, remember that you have created a form where you can extract the complaints, and you just you extract complaints and say, okay, it seems our patient, they don't like the way people talk to them. Then we might need to train people on communication. Okay, it seems that they don't like the fact that they wait for long. They might need to train people on time management, efficient use of time, so that patient will not be staying for. So training is very, very important. It's a measure of how efficient and effective our internal processes are. Next slide. And medication error or any form of medical error. How frequent do people give wrong drugs to people? You give like captopril with side effect of dry cough to a patient though having hypertension and having cough. How frequent do people give, another example, let's say alpha-metidopa that can cause erectile dysfunction to male patients when there are other options. So we check how frequent are medication error. And part of how to do that is we look at how frequent do people follow treatment protocol. So if there are no treatment protocol, it will mean that we start generating treatment protocol, and we can check, okay, how many conditions that we see in this facility have we generated treatment protocol for? That's another way to do that. And we can now gradually improve till we are able to generate treatment protocol for all common conditions. Next slide. Next slide. Then confidentiality. How often do patients complain that what I complain about in your facility, I heard outside? How often do that happen? So then we can now say we want to improve confidentiality and want to reduce confidentiality breach by a particular percentage. But you notice that part of what we do is that when we are measuring, you must put time and you must put the degree of improvement that you want. I want improvement by 10% by end of April. I want improvement by 25% by end of December. It is very important that you do it that way so that you are able to measure them. Next slide. Then, of course, how often do we engage in advocacy? Now, why is advocacy important? Sometimes the complaint of the patient is not what you should change. They are just the one that do not understand what is supposed to be right. Like, for example, a situation where a woman said the reason why pregnant people don't like to come to your hospital is because you don't wait for long before you quickly wheel them into the theater for cesarean section. You know, what could you have done? You realize the woman will not be able to deliver by herself. You need to do cesarean section. So in that case, you will now need to generate a team for advocacy and campaign on different delivery options, and make it clear that the goal is to have a safe mother and safe child. That cesarean section is not bad luck. You now get that? So sometimes some complaint of patient are not things that the healthcare facility or professional are going to change. When that happens, then you now need education and advocacy. Now the question is, how many advocacy agents is your facility partnering with? How many NGOs are you partnering with? Those are part of what you will use to measure efficiency and effectiveness of your internal process. Now you will see that by the time you want people to do all this, you are putting a lot of pressure on them, because they will do a lot more than what they have been doing before. Next slide. So another now is, how do you manage people? The doctors, the nurses, the physiotherapists, even the admin staff. How do you manage them? Because by the time you want them to deliver all these that I have been listing, you yourself will agree with me that they are going to do a lot of work. You are going to put pressure on them. So how do you balance improving on your metrics, yet being a people-oriented person, yet being a people-oriented organization? Next slide. Next slide. Note that emotional intelligence, that we call EQ, will need to be combined with IQ, intellectual quotient, that we are very familiar. What's the main difference? IQ is you know how. I know how to do it. EQ is I know you, meaning I know your emotion, meaning I understand what you are feeling. And we need to balance these two in order to ensure that we sustain our productivity improvement. Or else, when we drive people too much, they will leave the organization for us, and the service we're providing will get worse. You know, we are driving them with intention of increasing productivity metrics. But if we are not balancing that with managing them, what will happen is that they will leave the organization for us, and the productivity metrics will even get worse. So it becomes very important that we manage them properly. Next slide. Note that to be able to manage people, it involves learning and relearning. To be able to manage people, it requires what? Learning and relearning. Now look at this code. You will never change your life until you change something you do daily. Over time, I've seen that productive people, part of what they do is that there are routines. We always assume there's always a very big step that we need to take, but the truth is actually those daily habits, those daily behaviors, those daily decisions, they are actually what will determine what our productivity will be. So more or less, the way I interact with people, the way I talk to people, not just one thing, not just, oh, I'm paying them big money, but a lot of small other things that I'm doing daily is what will determine their perspective about my leadership, about the organization, or about the system. Next slide. So it involves learning and relearning. And the first thing that we must do to be able to manage people effectively, the first thing that you must do to be able to manage people effectively is to understand empathy. Then what is empathy? Our ability to see things with the eyes of others, our ability to hear things with the ear of others, and our ability to do what? To feel what other people are feeling. So more or less, why me as a manager or a leader is interested in producing the result, the target that I've been given, it is also very important that I try to understand what is the problem of my subordinate, so that I will know if I need to give them more education, if I need to enroll them in coaching, if I want to encourage them to go back to school, if I want to buy books for them, if I want to give them course material, if I want to give them videos. Because if I don't feel that, I will not really be able to help them. They will not like me, I will not like them. We'll always be in conflict, and eventually we will destroy the organization. Because a house that is divided against itself cannot stand. For any organization to grow effectively and sustain growth, usually what happens to a lot of organizations is that when we put pressure on other people, the organization will begin to grow initially. Then it will plateau and start deteriorating. That's what happens a lot of time. But to prevent initial growth, plateau, and decline, what I will need to do is to understand empathy and act appropriately in a way to ensure growth, not just growth, then sustainability of growth. Next slide. So empathy becomes very important. Note that the highest form of knowledge is actually empathy. How you will know if I really know you so much is me being able to feel what you are feeling, being able to see what you are seeing, being able to understand things from your perspective. A lot of times, the reason why a lot of people do not want to show empathy is they do not understand the fact that I show empathy does not mean that I agree with what you are saying. Let me say that again. I'm showing you empathy does not necessarily mean I agree with you. I'm just trying to understand from your standpoint, so that will help my own judgment and my own action. So it is okay to feel what people feel. It is okay to try to understand things from people's perspective, because that's the highest form of knowledge that we can have about people. And social skill is what we need to be able to manage people. Once we have developed empathy, what we need to acquire is social skills. Once we acquire social skills, we realize that we are able to manage people properly. By social skills, what do we mean? We are able to communicate appropriately. We are able to build bonds. When there's conflict, we are able to resolve it. We are able to ensure that people work in a team, and we are able to build leaders that are agents of change. Next slide. And just like I said, social skill is very, very important. And when it comes to skill, it can be taught. People can learn it. Some people are naturally good about, like, personally, I'm not a naturally friendly person. What do I mean? I'm not the kind of person that when I enter a place, I will just start greeting everybody. But I realize that as I grow in my career, as I become an individual that need to lead people, it becomes important to be interested in talking to everyone, so that they will know that I am interested. That I now begin to learn social skill. That, okay, when you get to a place, go and greet people, talk to them, find out about them, tell them about yourself. Social skill become something that we should learn. It's not something that we say, oh, I am not a natural social person. Very, very important. So we should get training about social skill, because it will help us in managing relationship. Next slide. Just like we have said, social skills and relationship building improves our ability to collaborate effectively and work effectively in a group. If I realize, or an individual should realize, that he or she is struggling to work in a team, the implication is the person lacks social skill. And what the person will just need to do is to learn about social skill. Next slide. Now, part of what you will always do after learning social skill is that you will understand that at different points in time, people are expressing different kind of emotion that has nothing to do with you. You know, a lot of time we assume that every reaction of people is about us. No, sometimes people's reaction has nothing to do with us. I remember there was a time that I drove into a bank and we needed to park so that we can enter the banking hall. And the security man there started shouting. Now, even his complaint was that he did not want us to park the way we have done. We parked with the back so that we were able to leave on time. But he did not want us to do that. He wanted us to park facing the fence, facing the block, instead of us backing. Then he started shouting. Now, he can as well tell us to park the way he wanted without us shouting. Then, by the time we adjusted again, when we are about to, because it was around the time of COVID-19, when we are about to enter the bank, he was shouting again that we have not used hand sanitizer. Now, all these are not major issues, but it became obvious that whatever that is the reason he's behaving like that has nothing to do with us. Probably he's hungry, probably somebody offended him, probably he's not feeling fine, but it has nothing to do with us. So we need to understand that sometimes people's reaction is not about us. If we are able to understand that, it will help us to determine our reaction and our own action. I always explain that it's always better that you are always acting and not like you are reacting to situations. Next slide. So, irrespective of people's action, we should be able to act appropriately. No, previous slide. Remember, we have said that social skill will involve clear communication, will involve building bonds, will involve conflict resolution and influencing people, ability to work in a team, then leaders that will be agents of change. Next slide. Communication is very important. You know, when we are talking or speaking to people, they are not only hearing what we are saying, they are also seeing our emotion. So we can ask somebody to sit down and they will sit down and say thank you. And we can ask another person to sit down and the person will say, why are you shouting at me? So it's not just what you are saying, but how you are saying it. Usually, when we are communicating our emotion more than what we are actually saying. So that should always be at the back of our mind, and it will determine how people will respond to us. Next slide. Next slide. Now, apart from communication, when there is disagreement, how do you easily resolve conflict? If you are wrong, how do you say you are sorry? There are steps to conflict resolution. If you are wrong, then you should be willing to apologize. And sometimes we say sorry not because we are wrong. We say sorry because we want to maintain relationship. Like, for example, usually we are walking on the road. Somebody eventually that is not looking at where the person is going decided to hit you. Despite the fact that the person that is not looking, what do? You just say sorry. You are not saying why are you not looking at. But usually when we are dealing with people we are very familiar with, we are not usually willing to say sorry. We are not usually willing to resolve conflicts. And it is conflict resolution skill is a very important social skill that a leader must have, because there will always be disagreement. Now, when there is disagreement, how do you handle that? When there are different opinions, how do you handle that? That is very, very important. There will be another time that we are going to talk about conflict resolution skill, because that's another broad topic on its own. Next slide. But we are saying it's a form of social skill. Then influence, our ability to influence people, our ability to change people. Part of how we can influence people is that when we try to influence them based on what they know. A leader is an individual that has capacity to influence people that they are working with. Now, if we are able to influence people, we will become agents of change. If there is need for us to increase or to improve our performance, part of what we need to do is that we must have communicated it properly in the way that we are going to ensure that everybody is on the same page. And it's not looking like somebody is just dishing orders without being concerned about the effect that is going to have on other people. It's very, very important that we take note of that. Because anytime we are increasing our productivity metrics, we are putting pressure on people, and it requires us to be able to influence them to do what we need them to do, not just to stay in position of authority as a boss to give order, but instead help them to see the reason why we need to improve on what we are doing. Once we are able to do that, we realize that we are going to get better results. Now, we can look at this. We realize that we said that part of what we can do we do logical appeal. All right, we do logical appeal. We argue in a way that it appeals to their conscience. Apart from logical appeal, we can do emotional appeal. You explain to them, if we do not do this, it will have negative effect. Like, for example, if we are getting bed, if we are getting room ready on time, the implication will be that we'll be able to take care of more people, and the health of people in our community will improve. When we influence people in that manner, we realize that they will cooperate with us more than when we are just trying to dish out instructions on what they are supposed to do. Next slide. Now, leader as agent of change. A leader will always need to initiate change, and there are steps that are very important in order to initiate change. The steps are broken into sub-steps. It's important that we break the step into sub-steps so that everyone can understand it. Like the first one, we prepare. What do we want to do? Part of the preparation is to convince people about what we want to do. The first thing, we prepare. What do we want to do? Apart from preparing, then we set targets. What is our target? Okay, now we want to increase the number of patients that are using this facility from 10 to 15. So the target must be clear. A lot of times, the reason why leaders are able to get the cooperation of their subordinates is that they don't even understand what you are talking about. So our target should be very clear. We prepare, we let them know what the target is. Apart from that, we ensure as we are taking control, you also help them to also take control. They take ownership of what you want to do. We are usually more committed to what we see as our own. But once we don't see things as our own, it becomes very difficult. Then we try and drive out waste. Just like we said, if facilities are not being well utilized, the implication will be that there's a lot of waste. Part of what we might need to do to prevent burnout is to ensure that we are not wasting time. People are not at work when they should be resting. Equipment that are not really being utilized are moved to where it's properly utilized. All this will help us to improve on our metrics without necessarily blaming people that have not done anything wrong. Another important thing that we should put into consideration, apart from driving out waste, is what I put here: advanced tools. There are tools that can do things better than others. We can focus on advanced tools. We teach people management. We focus on advanced tools. We teach people management. We ensure that we carry people along in what we are doing. And part of how to ensure that is to make everyone understand. Next slide. Is to make everyone understand what we want to do. Now, leaders that are change agents usually get better results. Leaders that are change agents, they usually get better results. But leaders that are managers and bosses usually get temporary results. Leaders that are change agents, they get better results, they get sustainable results. Leaders that are managers and bosses, they get temporary results. Then after some time, their action will infuriate people, and people will start to rebel against them. And how to prevent this is by developing social skills, understanding that communication is very important, team building is very important, bonding is very important, conflict resolution is very important, acting as a leader with change angel with good knowledge of what to do is also very important. And by the time we put all this together, we realize that we are able to manage people in a way that those people will in turn improve the productivity metrics. If we don't do that, we will realize that our initial progress will plateau and suddenly begin to decline. Now, can we answer these questions together? These are questions to check and test emotional intelligence. So, all right, the first question will be answered by Dr. Deogracia. All right, so do you have a second microphone? Or I should? All right. No, she will be the one that answered the question. Okay, all right. Dr. Deogracia, so you read the question and you answer. So kindly come forward. You are welcome. All right, so read the question and let us have your own answer with reasons.
Okay, the question is, you are a customer service representative and have just gotten an extremely angry client on the phone. What do you do?
Has that happened to you before, Dr. Deogracia? That a patient is extremely hungry because of something, not necessarily because of what you did?
Yes.
It has happened before.
Yes.
So what will you do? We have options of what you will do. Option one.
Option one, hang it doesn't pay to take abuse from anyone. Option B, listen to the client and rephrase what you gather he is feeling. Explain to the client that he is being unfair, that you are only trying to do your job, and you would appreciate it if he wouldn't get in the way of this. Tell the client you understand how frustrating this must be for him, and offer a specific thing you can do to help him get his problem resolved. For me, I'll choose option B.
Which is?
Tell the client that I understand how frustrating the situation is for him, and then I'll offer specific thing or to help him get his problem solved. Thank you.
All right. I will agree with you. I don't know if you want to say something about this.
Yeah, I agree with her point. No.
You said you agree with her?
Yes, I agree with her point.
All right.
You agree with me?
Yes, I will.
Yes,
It's a good thing. Just now, why is second option correct? Because you are showing empathy. You are showing empathy. And once individuals you are dealing with realize that you are showing them empathy, they will at least try and listen more to you. All right, so the next slide so that we can take a second question, then we round up this session. Your question, sir. Come and take the second question.
Okay.
We can't stay here. So you read the question, you let us know your option. You said, okay, you can move back. Okay.
Okay, it says a discussion between you and your partner has escalated into a shouting match.
Can you project your voice a little?
A discussion between you and your partner has escalated into a shouting match. you are both upset and in the heat of the argument, start making personal attacks which neither of you really mean. What is the best thing to do? The first option says...
Has it happened before that you and your colleague or somebody, you have a disagreement, either of the parties shouting?
Yes.
It has happened. I'm sure Dr. Deogresi also agreed that these are things that occur commonly. All right, so what will you do? Or what are you supposed to do?
Agree to take 20 minutes break before continuing the discussion. The next option says go silence regardless of what the partner says. The next option says say you are sorry and ask your partner to apologize to. And the next option says stop for a moment, collect your thoughts, then restart your side of the case as precisely as possible. I'll go with the option that says say you're sorry and ask your partner to apologize.
You can choose to another option. You can decide another option if you don't like any of those options.
In the case of, if I can just try to be more specific.
Yes.
In this aspect that says you say you're sorry and ask your partner to apologize.
Yeah.
The partner might not be sympathetic as you.
Yes.
Or have that empathy to go on with the
That I agree with you.
And demanding for an apology from that person will escalate the situation again.
Yes. Why are you asking me to say sorry?
That's another thing. And in this next case, this was the next option I could take. I say stop for a moment, collect your thoughts, and then you start your side of the case. You might want to restart your side of the case, and the person is still not willing to understand you.
Okay, so what do you do? What do you do in that scenario?
Take a break.
Take a break.
Take a break. We'll continue back with the conversation. That break might bring down emotions and everything. Then you come back with the empathy. When you come back to start the conversation, you start with an apology.
Okay. So your own submission is that take a break, then come back and say, I'm sorry that we need to shout at each other the other time. This is what I was trying to say. I get your point, but this is what I want you to see. Is that what you are saying?
Yes, exactly.
Okay, all right. Dr. Deogresi.
Me, I think I'll go for the last option.
Which is?
To stop for a moment, to collect my thoughts, then restart
the side of
the case as precious as possible.
Okay, Dr. Joshua. Let's have an expert review of the... Will you like to use microphone so that we can hear you well? We all agree that these options may not be your own option. So you can have another...
Okay, so the first thing is I've been in a meeting before where we had to take 20-minute break. So, that already gave me some bias. Yeah, so, and I really want to reprocess all the options with a very fair mind.
Yes.
So I don't want that to cause a bias for me. The truth about it is, okay, as a leader, there's one thing that we should first know. It is only in academics that when they set a question for us, we first assume the question is right.
Yes.
In life, the question itself may not be right. So as a leader, the way you always think is to first question the question and be sure the question you are answering is right. Because if you're a leader in healthcare, I don't expect you to get an issue to escalate to the point where you have a shouting match.
But it happens.
So something is fundamentally wrong.
Yes.
Immediately an issue becomes emotionally tensed, you should learn the art of keeping quiet. It's a principle, it's a given. At any point when an issue becomes what? It's getting emotionally tensed. As a leader, you should be either in your home, in any society where you belong to. Once an issue becomes emotionally tensed, The stakes are high, and the issue is becoming very controversial. You should know that shouting will never solve the problem. So what we do in that case is you need intelligence. You need more light to solve such problems. And there's always this theory, you will not solve a problem with the level of thinking that got you into that problem. I'm sure you know it's a popular saying, like John Maxwell kind of saying, yeah. So that's why I was trying to reread the question and reread the options. And so let's say as a leader, if you're not a leader in a scenario where you're leading a meeting and the meeting now turns out to become a shouting match. Now I've recrafted the question.
Yes.
Have you noticed that?
Yeah.
Option B would be what I would expect from the more matured person in the meeting first, and then option A would now be what I should say we should go for. So I've seen in several meetings where we just say let's take a 20 minutes break, 15 minutes break, like that.
Just for emotion to calm down.
And within that break, as a leader, you will go and talk to both of them, period.
Okay. All right, so now one thing that is obvious from this scenario is that it's not always that one option will be the best option. Sometimes you borrow experience, you borrow knowledge from different scenarios. So do we have any question, or we go for our tea break?